The Total Practice Management International Pre-Consultation, number 1 in the series of 7 different communications topics you would use in a modern chiropractic practice. This is the most difficult out of all the 7 topics. It's primarily the most difficult because you have to ask a long series of very customized and appropriate questions. That's not easy, but it can be learned. And then you have to critically listen to the answers, because if you critically listen to what the patient is answering, then you know where to go with the next question. Now this has structure. All the communication system has structure. None of this is built on charisma or energy. This is built on a system that easily can be replicated. Here is the pre-consultation. It takes 8 to 10 minutes to really do a great pre-consultation. Longer than that, and you're actually missing something in the quality of how you are approaching this particular visit. Now, there really isn't any scripting in any of the TPMI communications points. There is, however, an appeal paragraph lasting for a couple of sentences that works exceedingly well. You can add your own words, you can modify it slightly, but please say this appeal paragraph as closely to what you're going to hear as you possibly can. Mr. Smith, this visit is all about you. It's about your low back pain. It's about your problem causing your low back pain. And it's about the negative impact in your life day in and day out caused by your low back pain. There are some very important questions you need to answer. And the more specifically you can answer these questions, the more you will understand about your low back pain. The more you will understand about the problem that causes your low back pain, the more you will understand about the negative impact in your life your low back pain is causing, and the more you will get out of your care. There are 4 categories that are very important in your life. And you need to decide which of these 4 categories is being most impacted by your low back pain. Is it category number 1, your work? Is it category number 2, your recreational activities? Is it category number 3, relationships with people who matter to you most? Or is it category 4, your work around the house or household chores? Of those 4 categories, which is your low back pain bothering most? Now doctors, that's the appeal paragraph. That's the first of 3 main parts to the pre-consultation. Once the patient chooses a category, that's where you begin. You begin by opening up the major question in that category. Then you go to collect the life impact in that category, and then it is your decision to go to a second category in any order you'd like, the third, and finally the 4th category. You want to cover all 4 categories because there's usually quite a bit of information the patient can give you in each of these categories. So let's say in this instance, it's Mr. Smith is the patient, he's got low back pain, he's got a problem causing his low back pain, and he probably has some negative life impact. He tells you that the major category that bothers him the most with this low back pain is his recreational activity. What you do not want to do is open up that category or any category with a general question. For example, it would be a mistake to say, so Mr. Smith, tell me, how is this low back pain affecting you in your recreational activity? You ask that sort of a general question and you're going to get a general answer. Mr. Smith might say, well, Doc, I have good days, I have bad days. I mean, it doesn't totally stop me or anything, but it's not any fun. And what have you got? You've got nothing. But here is the deeper part of the problem. When a patient is answering with general answers, like that example, the doctors all too often look at the patient thinking, why don't you cooperate? This is easy. I asked you a question. Tell me. Well, you asked a general question. They obliged by giving you a general answer. Now, here is the concept in this pre-consult, and then you'll hear a proper question to open that category. The concept is this. These patients need to be looking in a mirror. You need to create, so to speak, a mirror for them to look into their own eyes and speakers on both sides of the mirror so that they can answer the questions you ask and begin to realize, my gosh, this really is impacting my life. Because remember, nobody walks in your door thinking about the potential of negative life impact. This is precious information. So the way in which to go through this pre-consult is never to try and make the patient feel like they are admitting that they've got a problem at work or recreationally or with relationships or even work around the house. You want to help them realize that as they open up and explain back to you with proper answers, because you asked very proper and specific questions, they need to become enlightened. They're not admitting, that's like pulling teeth. They are becoming enlightened. Oh my gosh, I hadn't realized this or that. That's what they need to be thinking. So the way in which to open up the category of recreational activity is simple, very simple and very specific. Mr. Smith, what are your two favorite recreational activities? He might say weightlifting and biking. All right, fine. Now you've got something to begin with. And we'll talk about the kinds of questions in the third and final layer of the pre-consultation in a moment. Before going on to that third and final layer, there are ways to open up each of these categories. What if the gentleman said work? Work is the primary category. Well, you'd have to open up that with a question like this. Mr. Smith, how many hours a day do you work? He might say, 8 hours a day, doc. So you might ask, in 7 of those 8 hours a day, Mr. Smith, describe exactly what it is you do at work. Now he might say, I work in a factory. Well, that doesn't tell you much, does it? He could be cleaning the floors. He could be working on a line. He could be lifting boxes. He could be driving forklift. He could be managing people. He could be in the office. Who knows? So you have to look at him and say, Mr. Smith, exactly what do you do in that factory? Oh, I'm a forklift driver. Aha. Now we have something specific where we can start asking questions so he can compare and contrast. And we'll do that in a moment. Take example, the third category. Let's say it is relationships. You might ask, Mr. Smith, are you married? Yes. Do you have any children? Yes. Are they living at home? Oh yes. How old are they? 3 and 7. All right, so you might ask, Mr. Smith, with your 3-year-old, what are just a couple of 2 activities you really get engaged in, you really like to do with your 3-year-old? You see, doctor, what you're doing is you're beginning to ask questions to dive into life impact. Now, that's one category. The objective is to go through all 4 categories, and the objective is to make sure that you attempt to get 3 contrast answers in each category. Contrast answer means that your first answer before you had the low back pain and you asked the question is different for an answer that now that you've got the low back pain. In other words, how often did you play t-ball before you had the low back pain? 5 nights a week. How often do you play t-ball now that you've got the low back pain? Yeah, same, 5 days a week. That's a parallel answer. That you don't even write that down because there's no value. So you have to ask another question and another question and a third additional question, trying to see if there are 3 contrast answers. Because it's the contrast answers that helps the patient realize that this is bigger than low back pain. And this is bigger than whatever the doctor already mentioned, a problem causing the low back pain. This is my life. I mean, this is what I'm dealing with. So the idea in this third level, you're doing more of a dance. When you're collecting this precious life impact, you have to come up with the right question, and you add the prefix before you had this low back pain, Mr. Smith, and ask the question. and then you dance over to the right now that you've got this low back pain, and you ask the same question. Unfortunately, many doctors forget to ask the question twice. And all they get is an answer, and they don't even know for what time frame. Was that an answer for when you had no low back pain? Or is that an answer for now that you've got low back pain? You have no idea. The fourth and final category, work around the house, household chores, needs to be opened with a proper question as well. That question is also pretty easy, and it might be, Mr. Smith, what are 2 chores around the house that you just have to do or you like doing? And he'll probably give you 1 or 2 different chores, maybe mowing the lawn and this year painting the house, could be. Then you've got something to start with before the low back pain, and you ask a question. Now that you've got the low back pain, and you ask the same question. So doctors, the 3 different layers, the appeal paragraph, not that difficult as long as it's clear and simple. The second layer of the pre-consultation, you have to open up each of those 4 categories one at a time with a question that is specific enough to give you an answer that then you can use in the third layer of the pre-consultation in developing the right kinds of questions to ask twice, before they had the symptom they've got and now that they've got the symptom that they have. In doing so, remember the patients are looking in this mirror. Guess what? When they walk out your door at the end of that first visit on day 1, instead of thinking, I hope this isn't a serious medical problem, they're now thinking, this is a serious problem. It's a problem that's affecting everything I do day in and day out in all these categories. And they don't walk out thinking, I hope this doctor is the one who can cure me. Instead, they walk out thinking, I'm in the right place. I mean, nobody's ever asked me questions like that. I had no clue that was all going on myself. They walk out thinking, this doctor really connected. This doctor cares. This really was a smart office to come to. Now finally, doctors, what you have to realize is in this pre-consultation, the stage is being set, a precedent is being set for a level of seriousness and a level of clarity to begin a journey of communications that will see the majority of patients in your office not only start and stay, but do it because they want to. Not only refer other patients in because they know that's the right thing to do. You peel that stress off your shoulders, put the responsibility on the patient's shoulders, and you have a completely different, not just bigger, not just more stress-free, but practice that will be absolutely wonderful. Doctor, thank you for your time and your focus in watching this video presentation. For more information to learn how this communication technology can make the big difference in your practice, call me today at 608-463-7474, and I will personally answer questions you might have and help you understand the best way that you can utilize this technology for yourself. Thank you.